How do you thank somebody for saving your life? It's just, it's beyond words. Thank you just doesn't seem enough.
Northwest 911, where is your emergency?
My husband, who is 67, is having chest pains.
I never gave it a thought that it was a heart attack.
Conscious and breathing?
Yes, he's conscious and breathing.
Let me start an ambulance. I'll be right back on the phone with you. This is Squad 91, Medic 95, across the Shire Rings Road on chest pain. It's on Northwest EMS 1 to mile 1718.
We get in there and we see this man, and we're taught in school to diagnose quickly, whether we need to transport fast or we got time to stay and play, what we call. And we've seen him, we know he's sick, sick or not sick, and he was just sick. He had sudden onset difficulty breathing, sudden onset chest pain. Called his wife outside. His wife, without hesitation, called 911. We are able to respond very quickly. We got there. We started treating. We knew right away what was going on, put on a cardiac monitor, kind of verified the fact of what we saw was in fact happening, the heart attack.
So we got him out to the garage, got him on the cot, got him comfortable, and moved him to the back of the medic where we could cool him down and kind of do our assessments on the way to the hospital. I recall that he had some elevations in his V leads, which really concerns us. At times they have initiated them as widowmakers. A lot of times we don't have a real good chance of getting those back when they arrest. So we got real aggressive with him with IVs, with his nitrates, aspirin, trying to keep him comfortable on the way to the hospital.
Due to the nature of our confirmed MI, Riverside was the best place for us to go, as it is a heart center. And we decided that we should probably go lights and sirens and get there as quickly as possible, as this was new onset and we were still within that golden hour of where we can really affect change. And
as Tom was asking the patient questions, he started to lay the patient back after he saw a PVC because he knew what might happen. And sure enough, by the time he had asked him 3 or 4 times, how you feeling, as the patient's head was reclining, by Tom moving the cot. The patient stopped answering him, and it was right up until the last second when he said, "I feel fine." Monitor changed. Tom had taken the patches out, placed them on the patient. Then what seemed like a split second, he defibrillated the patient and was immediately on the chest. We notified the driver that he should call the hospital to let them know that we were bringing in a full cardiac arrest.
It seemed everything was going okay. As I was checking, they were given some medications to get an IV established. The patient was talking. And then as we passed the Twin Water Towers on 270, I happened to look up and the corner of my eye saw a shock being delivered.
Squad 91 Northwest.
Squad 91.
Progress. We'll be there in 5 to 7.
Okay. Riverside here, this is Sarah. How may I help you? Hey, it's Washington Fire. I have a medic en route, Medic 91. CPR in progress, 67-year-old male.
Okay.
TA is about 5 to 7.
Okay, sounds good.
All right, thank you. Squad 91, they've been advised and are expecting you.
Mr. C.
His heart went from a rhythm that's non-compatible with life to a rhythm that gave us a chance, gave us some hope that we could get him back.
He became responsive again to where he was trying to push Tom off of his chest, which is a great thing because, the brain's functioning at that point and, he's somewhat awake. I remember the patient becoming less and less alert, and by the time we swung the truck into the EMS bay where we were parked, he went into cardiac arrest again. By the time we got into the trauma bay, it was all hands on deck and they were ready to take over, but I just felt like the walk from the truck to the trauma bay at Riverside was like a mile long. we had just got this guy back, and it was a terrible feeling that he was going unresponsive again. And it's just kind of, not that you lose hope, but you just saw that all the good you did kind of seemed to go out the window. But
Walked in the ER, and they took me back to a room, and the chaplain met me. I knew. He had arrested, and that Washington Township was bringing him in. If he was going to make it, he was going to be a vegetable.
I was really literally dead 5 different times, and I kept getting revived and revived. Everybody kept saying to me, "You're a miracle because you should have died." And due to what Washington Township Fire Department did and the EMTs, they kept me going. They kept, between the man upstairs and the EMTs that worked on me and didn't give up on me and did all those chest compressions to keep me alive and keep me going with their expertise and everything, I was able to make it, and I should have not made it. They said I was beyond belief that I could make it and still have everything intact, not be affected in any way physically or mentally. It's little compared to what I really owe them. I owe them my life.
The stars aligned that day, and it was a great feeling, something that makes coming to work so worth it.
Just that I am so thankful that you was able to share that with me, and that kind of makes your day. So thank you.